welcome to our webinar in March. This one's going to be an interesting one on systems navigation, and I'm really excited that we have somebody who's an expert in this from the ground up, joining us from Ontario. But in the meantime, let's see who's in the room. So if you don't mind trying out the chat feature and saying hello and what community or organization you're from, and if you know, this is bonus points, if you know the treaty or Indigenous name for your community, that is also super welcome. So I'll start us out in the chat, and then let's see who else is here. So, all right, there's me. And we've got about 99 folks, 95 or 99, I can't quite remember. So big group. Some of you will be here hammering us with questions. Some of you might be watching this and at your own leisure later on. But feel free to connect with us anytime about anything that comes up here. And we're going to give folks another minute to join, and then we'll get going. But yeah, say hello in the chat, and then we can say hello back and do some shout outs while we wait for people to log in. And let's see. I don't see any in there. Oh, there we go. Stella. Hi, Stella. And she's joining us from Yonge Street Mission in Community Development. Awesome. Nice to see you. I think I might have met folks from your team not that long ago. Really cool work you're doing there. And awesome. Yeah, bonus point for you as well. And Spencerville, Ontario. Thanks, Mary. That's awesome. We do have lots of folks from Ontario, but also Alberta and BC today too. So for sure a nice representation. But yeah, say hello in the chat. We've got Karen, Romero House, Caronto. Awesome. Good. Mosaic, PCN in Calgary. Hi, Seema. PCN, for those of you that are not in Alberta, is a primary care network. So this is where folks are connecting with community members from a health perspective, public health perspective. So nurses and family doctors, and the whole idea is getting care to communities where they live in a more accessible way. And it's a really cool thing. We're part of a PCN ourselves. Amber Rose from Addictions and Mental Health Ontario. Welcome, Amber Rose. A really interesting paper that came out on supportive housing today in Ontario that I'm sure you're looking at with interest. Saskia Kwan from Amplify Engagement, Community Engagement Services. Awesome, nice to have you, Saskia. And I'll do one more, and then we'll get going. So Danielle from St. Leonard Society in Ottawa and Algonquin Anishinaabe Territory. Awesome. Don't let the chat activity make you think that it's only Ontario folks. It really is folks from all over Canada. So please do continue to say hello in the chat, and we will get the party started in the meantime. So I'll start with the land acknowledgement myself. I'm joining you from Treaty 7, which is known as Mohkinstsis and today's Calgary. Beautiful area here. We can see the Rocky Mountains on a good day, but right now looking at snow. So you know, I'm very jealous of colleagues who are already hitting the spring season. But yeah, welcome. Our team at Help Seekers from across Canada. So we're always really excited to meet others from our beautiful country, especially at a time when being Canadian is an interesting thing to be, which wasn't the usual thing we're used to. So I'll share my screen, and you know, let me know somebody from my team if this is not visible, but I think we're good. So if you don't know why you're here, hopefully this clarifies it for you. We're going to be talking about service navigation and how we might leverage technology and data to support this process. So systems mapping is a term you're going to hear a lot today. And we're going to be showcasing some of the work that communities are doing. And Mary is, she's going to introduce herself when her turn comes up, but she's the lead implementing a systems change effort in Edwardsburg Cardinal. So we picked a regional community that doesn't get a lot of attention in these types of webinars. They're doing amazing work. B, a lot of communities are in a very similar boat as them, really spread out, not a lot of resources when it comes to coordination efforts. So what can you do in a resource constrained environment with what you've got? And so I think that majority of people's experience from what I'm seeing across the country, rather than we have too many services kind of problem. It's the what services do we even have, and how do we connect them together, and how do we manage the gaps? And so I think what they're doing is really, really cool. And so we invited Mary, who's the lead there, to speak to that process, and she'll do so in a second. Well, I'll set her up though. So when it comes to why we're here, the big takeaway that I want you to consider is that despite lack of resources, and despite the resources that we do have, there's still a consistent problem when it comes to people understanding what is available and finding the right help when they need it. And the idea here is that municipalities or communities, and in general, it doesn't have to be municipality or local government per se, but communities in general need better tools to structure service data and to support their decision making when it comes to what's out there. So we're going to walk through what systems mapping structures are when it comes to service data. So there's systems mapping for everything under the sun. Today, we're really specifically talking about services and using systems mapping techniques when it comes to service mapping, and bringing those services to tools that can help people navigate those services. So we're going to talk about our tool, of course, because we got to sell software. That's what we do. But you can apply this to other software as well. So you don't have to only look at this as a one software solution. We'll talk about a community's implementation efforts, and then I'll show you actually what this stuff looks like, so you get a really solid idea of what it is. So what systems mapping in the context of service navigation? Systems mapping, to put it really, really plainly, it's just a structured way, a systematic way of organizing information. In this context, we're specifically talking about organizing services that are meant to help people with diverse social, health, justice needs, whatever that societal need might be. The tool and the process are really about categorizing that information and bringing it to them in a way that's easily consumable. So all of those pieces come together in this process that we refer to as systems mapping. But the whole idea is that we're connecting the dots between what a local community needs, and be that a municipality, be that a network, a primary care network would be another example, a municipality or a local government, a First Nations community, exchange the terminology there. It's somebody that's in charge of coordinating this thing at a local level on a particular theme. The theme might be, I need to organize everything in my community within this jurisdiction. Another theme, and we're doing a project on systems mapping childcare services with Government of Alberta right now. So for them, it's really specific around the theme of childcare, but their jurisdiction is all of Alberta. So it really, really varies what people's focus might be around navigation, and what the theme might be, and the scope might be. So don't think that there's a one size fits all. If you think there's one size fits all, then I did not do a good job today to ensure that it comes through. The whole idea, though, and what is common across all of them, is that municipalities or governments, service providers, and residents need to know what's out there and how to use it ultimately. And sometimes it's simply for the decision making, or where do I get this specific type of help? Where do I find childcare? Where do I find my healthcare provider? Where do I find my shelter? Where do I find my addictions mental health treatment facility? Whatever that need is, they know how to navigate to it. So that's one type of decision making, helping myself or helping somebody I'm helping. I'm a caregiver, so I need to help somebody find the right supports, and I'm sitting with them and figuring out our strategy. And I'm a caseworker, and I'm helping my client navigate the system. So that's one use case. The other one is also the decision maker. So the people at the top that are trying to figure out what the gaps are, Well, you can't figure out the gaps if you don't know what's there to begin with. So it can really lead to poor decision making if you don't have that baseline of what's out there. And as we all know, the baseline changes all the time because it's a very, very live dynamic system. Funding comes and goes, programs change, etc. So I also don't want you to think that this is a one and done type of effort, because the system is not static. So it really is something you build a muscle around within your organization if this is important to you. So the other technical piece that I want to make sure comes across, and this is something that we learned the hard way, is there is no way of categorizing everything consistently every single time for every use case. There is no Bible for categorization. In technical speak, we talk about those as taxonomies. And if you remember your grade, I forget what grade we learned this, but the Linnaean classification of species, subspecies, right? That's one Linnaean classification system. That's one way of, classifying animals. Indigenous ways of knowing have their own taxonomies as a really good example. And those vocabularies and ways of making sense of terms are very, very context specific. And the minute we get into the one taxonomy to rule them all, it becomes quite problematic. And there's always somebody that's not going to be happy with it. Now, I'm not saying that localized taxonomies are the right solution all the time either. Sometimes you do need to have let's say a provincial childcare taxonomy. We do need to understand, what's licensed versus unlicensed. And sometimes we do need a federal taxonomy of what's transitional housing versus emergency shelter. But what I want to convey is that those are arbitrary. They are actual folk taxonomies. They're grown organically, and when you actually break them down and you understand, well, transitional housing for this government is 2 months to 6 months, stay in emergency or in a transitional facility, but for this government it's up to 2 years. Well, the person that's trying to figure out where to send the client, they are managing 2 taxonomies at once when they're looking at decision making. So that is one consideration, is that there's no one taxonomy. What you actually have to do is understand that these are different taxonomies and have a way of lining them up in a way that makes sense for your use case, for what you're trying to accomplish. So if your taxonomy is about helping people find services and you're targeting help seekers, hence our name, help seeker. If you're targeting clients that are in need of these services, then you got to think of the taxonomy from their perspective, and how you as a funder or as a service provider think about services is not necessarily how the client thinks about services. So you really got to flip the script and think of it from their perspective. And you got to make some compromises. So even though it makes sense to you, it might not make sense to them. And how do you make it so that it can roll up from a data management perspective? And so there are absolutely ways to do this. And again, this is not meant to be a technical webinar about taxonomies and ontologies, but I do want to make sure that you guys have a sense of the importance of thinking about the terminology used from the stance of the people you're doing this for. If it's for a funder to make a decision-making process more smooth, that's one taxonomy. And if it's for the local person trying to navigate things, well, they're not going to know that transitional housing is defined as something specific. You got to break things down for them in a very, very easy to understand way, or you're going to probably make their life even more complicated. Now, here's the interesting thing. Taxonomies can coexist. So what your funder wants to understand and what your executive director wants to understand and what your client needs to understand can actually be lined up, right? So you don't have to make a compromise is the takeaway. You need to line up the taxonomies and through common concepts and have a kind of a map of how these terms relate to each other. The technical term, just if you want to sound fancy, is an ontology. But again, that's its own conversation. The takeaway here is a well-structured taxonomy ensures better service and better planning, because you've got a really, really clear set of terminologies that you're using. and it's not one size fits all. So we're doing a project right now with Jewish Family Services in Toronto. And it's a regional project in a big city, of course, Toronto, and it's one of the largest Jewish communities in the Jewish diaspora. When we went into this project, we weren't quite sure what the focus was going to be. Turns out that the focus is really specific to clients, not Jewish families and individuals that are navigating services in Toronto. And my assumption about that was, well, they're going to want to know, are you a Sephardic Jew? Are you a Ashkenazi Jew? Like, what kind of dialect do you speak? And the reality was very different. Culture was really critical in every listing. There was a lot of things I didn't know. And if you don't actually ask the end user that you're making this for, then the tags, the things that are in the drop-down menu for the client finding the right service are not going to line up with their needs. That's the bottom line. So I never knew that, some of these aspects were going to be so critical. And I was, for instance, really put in my place, because one of the things I didn't include in the taxonomy was gender diversity. Obviously I know better, but I was in this mindset that it was all about the Jewish traditions and religion and culture, and I forgot the obvious, right? The diversity, and it's a major need in the Jewish community in Toronto. I mean, I didn't know. I wouldn't have known that if I wasn't listening to the folks on the ground. And so that's my lesson for myself, and hopefully for those of you that are taking this on as well. 2 ways to use systems mapping. I mentioned it, I'll say it again. And you got to be really smart about this, and they're not the same thing. One, are you using it to make decisions about service gaps? Or are you using this on the other side for public service navigation? And how you present the data, how to categorize the data, the kinds of data you collect might be the same, but the way you present it is very different. And I'll show you some examples of that. So this is an example of a systems map that's specifically designed for decision making. So again, I mentioned the Government of Alberta. I'll mention them again. This is a project that we're in the middle of, where we're mapping all of childcare, licensed, unlicensed, interesting, and we're categorizing it according to their funding priorities and their negotiation with the feds, etc. Very policy oriented is the point. And they want to understand what predicts supply, demand, and do we have enough supply in key areas? And what this map essentially shows is some of the economic correlations between childcare availability and social system health in certain communities. And the takeaway here is that if we don't have enough childcare of the right kind of childcare, because not all childcare is the same, parents need sometimes Indigenous, culturally relevant childcare. Sometimes they need informal care, multi-generational households, etc. Language matters. The kind of language that's being spoken in the childcare matters for parents, and the success of that service. So from a policy perspective, those things matter. Now, how we advertise childcare to parents, you're gonna think about things like, does this offer Montessori? Does this offer kind of play-based developmental activities? So what are the things that the parents care about are gonna be very related, but still visualized very differently than something like this. Like a parent would not know what to do with this, right? They're not policymakers. So again, understanding that is really key. So on the side of what does the parent need to see, how does the parent navigate this information, or the client, a prospective client? What we ended up building is a navigation tool that helps us take all of that data and make it user-friendly, and an app essentially, right? To put it bluntly, that lets people filter by things that they care about. So they care about location, they care about eligibility. Am I eligible for this? They care about what the service is. And sometimes they care about, does this have a special focus on me, right? On my characteristics, and on, I self-identify as a particular group. Having things that are really tailor-made for me matters to me. But that's very different community by community. And so that type of work is where the magic comes in terms of partnerships with community. Software and systems mapping is only as good as the people running the show on the ground. So how it works, and you'll see this in action when Mary speaks, it's the idea of having all the services in one place for easy access. It's the idea that you can search and filter to make navigation simpler. So things that people are already doing. Everybody knows how to use OpenTable. Everybody knows how to use Google Maps. All of those features that are typical in big technology that everybody uses day to day, have that. Make sure that the data is accurate and up to date. AKA, you can't just do it once and walk away. These things change. You got to update it as frequently as you can afford, essentially. And it's designed for residents and providers and municipalities for the purpose of navigation, not for the purposes of analytics. That's a whole different conversation. So building a high quality service directory is all about usability. Having a validated database, having government and nonprofit sources, having those community relationships to keep the information accurate and prevent duplication or missing information is key. The more you use it, the better it becomes, because as people use it, they critique it, right? They give you feedback, and then you keep improving it. And so you need things that are not set in stone. You need things that grow with you and your expertise as you roll this out, if this is something that's important to you. But again, I really want to emphasize this is a commitment. It's not a little, off the side of your desk effort. So the idea is to customize it. Branding, messaging, all of that is really essential for things to get picked up in your community. If your community doesn't see themselves in this, it fails miserably, right? Again, Mary and I we had some interesting conversations where I think she was kind of pissed off at me sometimes, because she's like, that's not how our community works. And so, yeah, we had to create a really specific taxonomy for Mary's community, but Mary knows that community inside and out. So you need that local expertise, and you need to listen to that local expertise, because you're not the one that lives there. Our job is to take what's in her head and what the local knowledge and expertise and wisdom is, and put it in a software format so that she can take it out on the road and do what she needs to do with it. So with that being said, I keep talking about Mary. So here she is, Township of Edwardsburg Cardinal. It's right outside of Ottawa, as I learned over the last couple of years working with them. She's a community engagement consultant that supports these activities. So she's actually really, really good at branding and communication and engagement. And she knows everybody, which is kind of what you need. So it's a perfect kind of catalyst for an effort like this. Our job was really to help her do her work. This really is her work. It's just backed by our software and our kind of grunt work, but I'll let you take it away, Mary, and I'm happy to move the slides as you go, and then we'll make sure we have some space for Q&A and a quick demo as well of what you guys ended up building.
That's great. Thank you so much. It's great to be here to share with you this project that took a bit of time to get off the ground, but it's now launched, and we're having amazing feedback from our community and the organizations that are listed. So we branded our Navigi platform as EC Connects. Our township is called Edwardsburg Cardinal. So we wanted to have sort of a catchy brand to signify to our residents that we're doing just that with this application, is connecting them to the services and programs that they need. So today I'm going to highlight a bit about how we worked with Help Seeker and improving the Navigi platform to make it effective for our residents. They were very patient with me, as I know my community very well. I've lived here for all of my life, and I've been involved in the community as a volunteer and executive director on a few boards. So I have deep knowledge of how our residents would benefit from these services being shown to them on such an application. So Edwardsburg Cardinal is a tiny little place along the St. Lawrence River, just south of Ottawa, about 60 kilometers. We have only 7,500 residents, but we are, after amalgamation, in the 90s, I believe, we absorbed Cardinal into Edwardsburg. And so we're kind of broad geographically with only 7,500 residents within that territory. Also in this area of Ontario, we have dual level government. So we also have the Leeds and Grenville County that we're part of, which helps us with some programming and funding as well. So we wanted to take into consideration the services that are available within our own municipality, our neighboring municipalities, and even all those municipalities that are part of the greater Leeds Grenville counties. So working closely with Help Seeker, we enhanced the search functionality. We wanted to focus on direct and accurate links to these programs and resources. To this approach saves time and it reduces frustration to making the platform more effective for everyone. An example for that is Navigi could bring us to, so I didn't want our residents to search the platform for a service or a program, and then we led them just to the program provider's website, and then they had to search again. So Alina and her team were able to help us bring in over 200 different organizations that offer almost 500 different programs. So they could really zone in on exactly what they were looking for, which I think really increased the user experience. Another challenge that we have here, well, rural Eastern Ontario, internet is a challenge, and it's expensive for good internet. So we had to make sure that load times and things like that really worked well so that we would have good engagement for people to use this great service that we were putting together. So EC Connects, our EC Connects brings in all of the great elements that Elena was speaking about, you know, the social resources and the housing and the food, but we wanted ours to be a little bit more special. And we wanted to include things like the libraries and cultural experiences and religious organizations and pharmacies, you know, so it was a little bit deeper than some of the other platforms that are available out there that we were able to customize this one. And that's what made it special to us. So whether someone's looking for a food bank or a fitness class or a local heritage program, they can find it all in EC Connects. And this made it the most valuable tool for our residents. On these slides, you're seeing some of the marketing elements that we put together to market our program. We launched in a soft launch at the end of March, and so we're full into our launch now. We fully launched early April. We did press releases and we're doing all kinds of networking on social media. We have a trade show, a community trade show that's happening later in April, and we're going to be marketing this program there and sharing it. We're going to have some tablets and sharing it with our community so that they can see how it's been made and how it works. Also, Navigi, our Help Seeker, was really great to make a couple of videos for us. One was an introductory video and another was a how-to video to explain to our residents how they can be used. So what else do I have to say? Yeah, so that's good. So looking ahead, you know, we're only in this for a few weeks and we already had an idea of how we could even make it better. So EC Connects is not a static project, as Elena said, and there's lots of upgrades, and I work closely with the team at Help Seeker. We're hoping and thinking that, you know, we're only in the initial few weeks and we're getting a lot of feedback from our organizations. Oh, we could put this in there, or this could look a little different, or we think this would be better for our clients. So we're working closely, getting that looking how it would most benefit those that are using the system. As well as someone mentioned to us, actually one of our volunteer board members from our community development committee, suggesting, no, could we use this to recruit volunteers? And I'm like, oh, that's a cool idea. So we are going down that path of figuring out how we can make that work best for our community organizations. and to try to have EC connecting volunteers. So that's kind of cool. What else do I have to say? I think that sort of wraps it up. So we're committed to refining this platform and expanding partnerships to ensure that it's a valuable tool for everyone. And if anyone has any questions, I'm happy
Yeah,
to.
we actually already have some questions.
Okay.
Yeah, okay. So talking about how you guys came up with your tags, essentially your taxonomy, your breakdown of services, and yeah, tell us about that process. People are asking whether you
So
build
it started with a list that Help Seeker provided, and I just dug a little bit deeper, maybe a little deeper than we had originally anticipated. Um, so we kind of thought about our small community. We wanted to make sure we could include as many resources or all the resources that are right here in Edwardsburg Cardinal. Um, and we wanted to also, if what's an example? So in Edwardsburg Cardinal, we don't have a doctor's office. We have pharmacies. We have practicing massage therapists, but we don't have a physician that's in our area. So they would have to go to the town of Prescott or North Grenville, which is Kempville, to receive medical care. So we wanted to make sure we don't have a hospital. The hospital for our county is in Brockville, and there's another one in Kempville as well. So we wanted to make sure that we wanted to expand the geographic, I guess, area to make sure that the services that our residents were looking for were included, even if they were outside our township. Does that answer the question?
I think so. Yeah, for sure.
Okay.
For sure. Folks are asking about noticing like where people tend to use it from. Is it laptops, mobile devices? How are they using just like the practicality of where, yeah.
So I don't have any statistics on that. Nicole from Help Seeker and I looked at that briefly the other day. So we're only, 3 weeks in. So we're still learning that. I personally have tested it on all three of those platforms, tablets, mobile phone and laptop, and it works amazing. We did make a couple of tweaks just to make it better at the mobile level. And that it was easy for us to ask, and it seemed to come relatively quickly. So I assume it was easy for Help Seeker to provide. So I think it's usable on any device, from my understanding.
So it really depends on what the user prefers. If some of them are more mobile, some of them might
Yes.
be, library users of intranet, etc.
We have asked our local public libraries to make sure there's an icon right to the platform on the local public library computers that are for public
Oh, good
use.
call. Yeah,
Yeah.
that's
Yeah.
excellent. That's excellent. That's awesome. Thanks, Mary. I think there's a couple more questions too, but
Sure.
why don't I show them, and then you can also kind of tell me the things. It might spur you. I'm going to do the
Sure.
demo with you, with me,
Oh, sure.
with you coming along, if you will, as the local expert. So yeah, so here's what it looks like. So if you guys see down here, these are all this is what we mean by taxonomy. This is what we mean by taxonomy. So the fact that there's a childcare service, and within it, there's early childhood, there's daycare, there's child development, there's parent child. So these terms were tailored to this community. So I
So
want
what's
to,
interesting about this is
yeah,
clients can have, residents can have an option to scroll on this list on the left, or they could just, use the map as well to kind of hover over what each service or organization is. You can drill down right
exactly.
to where they
Yeah,
are on the map. And on the left, you can see there's a description of the services that are available there, as well as hours, if we could find them, and the phone number and the website. So this phone number from a mobile device is actually clickable, so it can connect right away to your phone app. And the website clearly would connect to your navigation app.
yeah, great. And these icons, I think they were also custom made for for this community to make sure it fit with the right, like it's primarily a Christian community, so we didn't we didn't go out of, you know, we were on side by choosing, for instance, a cross, right? But even these things get custom made because not everything is the same in
And they
community.
were great to keep it in branding with our township colors.
Yeah,
So, yeah.
yeah. So another view here. Tell us about I was gonna say, tell us a little bit about the things that were new in here that you didn't see at the beginning. Was it, you mentioned pets and animals. Let's see
Pets
what,
and animals we added the local pharmacies. Because
yeah,
there are 3 pharmacies. Our community's aging, right? So they need
yeah.
these types of services. So pharmacies we added. We really spent a lot of time on the religious organizations because it seems to be important to our community. Those not just for members of the churches, but also often our churches here are used for community events. So like our
Mm,
local scouting and guiding organizations hold their meetings in these religious buildings.
mhm,
So that was a great way to allow people to find the locations of those programs.
mhm, mhm. And what's interesting here, because you were talking about volunteerism, I mean, easy enough, volunteer services could add volunteer opportunities as well.
Mhm.
As
Yeah,
a so
yeah.
point being, as these things grow, as the community gets excited and say, hey, we should put this, we should put this, we should, does this need another category? Or and that category then is something that others can look at to say, hey, maybe we should be adding this into our into the offerings. This is an interesting one that is not usual. Let me clear the filters. Environmental. I don't think I've ever seen this one in any other community before. But yeah, Ferguson Forest Center. This is an important this House of Lazarus Youth Hunting Certificate. Super
They
interesting.
have a program where they educate the youth on safe use of for hunting.
Yeah,
Yeah,
yeah.
yeah.
And I never even heard of this before. It's
Mhm.
very cool. Very cool.
So that community is a big, rich in agriculture and homesteading and that kind of thing. So that's where that resource is required for sure.
Yeah, yeah, no doubt, no doubt. Super interesting. Like it's got so much richness, and I hope you guys can see how you know, oftentimes we say, oh, rural communities, they don't have anything. No, they're actually, it just looks different in rural communities.
Right, so it's a little bit more spread out. You can see that at the top of that screen, this is the town of Kempful. It's one of the biggest um, um, cities, towns, whichever in our Leeds and Grenville County. Another one, if you zoomed out a bit, you would see Brockville, which is a little bit more toward Kingston here. That's why that map is really busy. So clearly bigger
Mhm,
centers have more services.
mhm.
Yeah.
Awesome. Let me just check on our questions and let's see. Yeah, we've got a bunch more. Uh, Okay, is this available in different parts of Canada? Yep, yeah, it's wherever you guys want to do it. It does not matter to us. We've done them all. Community partnership. Okay, what do you mean by community partnership? What's the community's responsibility? Have different, okay, your resident are going to be afforded.
Okay,
So,
so we've asked for some engagement from the organizations that are listed here to help us keep their information up to date. So when we launched, actually even previous to launch, I think we sent at least 2 emails out to these organizations asking them to look at a test system that had been prepared by Navigi and was their organization represented as they would want it to be and as their residents or clients rather would like it to be. And we had some feedback. We had quite a bit of back and forth. And in fact, just in the last couple of weeks when we launched, I sent that email again and said,
mhm,
okay, we're launched now. We're still taking feedback and and making adjustments to make this work well. We've put all this effort into it. We want to make sure that the information in it is accessible and being used. So still I'm getting email as 2 weeks later, I'm still getting emails from organizations, and I'm sure Nicole is probably getting, there's a form to submit. Actually, we didn't talk about that.
Yeah.
We can talk about
Yeah.
that. There's a form to submit edits right on the platform. So those go directly to Help Seeker. And when they have a question about something that might need clarification, I get involved. And sometimes because I sent that email telling the organizations that it was up and running, they're replying right to the email, which is fine. So then I'm facilitating some tweaking, if I could say that way. Yeah.
You guys see the form, Mary, you see the form right now?
I do. It looks good.
Okay,
Yes.
good. Okay, good,
Very
good, good.
easy form. It's a Google-based form, easy to
Yeah.
use.
Yeah, nothing too fancy.
Sometimes, actually, I've been communicating changes that need to be made on the database with the Help Seeker team using that form.
Helps track it for sure, for
Yeah,
sure.
yeah. Oh, and I wanted to understand the experience for the residents, right?
Yeah,
So as
yeah,
well. Yeah,
absolutely.
yeah.
Yeah, so I guess our takeaway on this is, you know, the software, the technology people do their part. Our job is to make sure this thing is stable, it meets the needs of the community, but it's the community, you know, leaders and community engagement facilitators that are responsible for getting this in people's hands and making sure everybody's excited about it and it meets their needs. Because the software people can't do that for you guys, right? It's you know, it's Mary doing that
Right.
piece. It has to be somebody's accountability locally, or well, it really does fall apart. And we've done these in many communities where it's like a one-off and it really kind of flops.
Yeah. So we've decided that we will maintain the system 4 times a year, not necessarily quarterly. We've jiggled around, you know, around Christmas, we want a particular time that it happens. And then again in the spring when spring programs are happening, you know, swimming and those things. So it will be 4 times a year, not necessarily quarterly. So that process is going to be Help Seeker does their magic, scraping data, however that is, and then sends a report to us about what's looking different from original or what's looking different from what's in the database now, and deciding whether we're going to go ahead with that update automatically or we're going to dig a little deeper because, you know, if we did all this work in finding a particular email address that is listed, we don't want it to scrub it out only to have the same problem later. So we're just going to be doing some vetting about 4 times a year.
Yeah, exactly. One thing that somebody asked about is orgs. Do we map orgs and programs? And the answer is you kind of have to do both. So this is just if you wanted to understand what the organizations are, these are organizations, County Cat Sanctuary, interesting. And these are programs. And of course, you can look at them together as well, right? So gray being the organization and blue being the program. And the reason for that is sometimes the organization and the program are quite distinct in terms of what they do, the population focus. So a program might be really specific for, you know, children, but the organization serves families as a whole. So you got to find the
Example
program.
of that is that youth rifle program you found.
Yeah.
That is also, it's a thrift store, it's a food bank, they have free meals for underprivileged people. So they have so many programs at that place. Who would think if you know, unless you're looking for it, you wouldn't think about a rifle program being there, you know,
Yeah. No,
they look for the needs of the community and fill them. So
Yeah. And the fact that that program exists and has existed for 20 years probably means it's got a good following.
Yep.
And clearly people like it if it's still popular in the community. So yeah, absolutely.
Selena, I have some questions here in the chat.
Sure. Yeah, go ahead.
They get covered. So some of them are directly about Navigi itself. So does Navigi have a set of taxonomies or does the user build their own taxonomy?
Yeah, I mean, of course, we have a library of taxonomies and this is how we were able to speed up what Mary was doing, is to say, hey, typically communities have food, they have transportation, they have mental health, they have addictions, they have homeless services. So there's kind of your base taxonomy. And it gives you a really nice start. It also reinforces that there is this concept of wellness and well-being, the holistic well-being that we have we buy into at Help Seeker, that everything's connected and we need to represent the needs of the community and the person in a holistic way. So we always start out with that well-being kind of approach to taxonomy development, but then usually the community will say like, that one is like, no way, we don't care about it. Or we really need to just focus on children or on mental health. So even within that though, you can really drill into the taxonomy at 7 different layers. So far, that's what we have. So in the gender-based violence taxonomy, the base taxonomy that we start out with, there's about 360 kind of base terms, and those roll into 1,000 tags. So if you really want to map the, the details out in a specific tranche, because that's really important to you, then absolutely. It's just to say that you really still need to think about it as well. Like, you don't take our word for it. You know your community best. Again, we make assumptions that may not pan out because we don't know the local context. So it really is a collaborative process. Now, we have expertise in building taxonomies. We'll do it for you, but we need your feedback. So when we developed the taxonomy, Mary didn't start from scratch. Mary reviewed what we put together and said yes and no, and you're missing this, add this. So it's we try to take the work off of everybody, but I wouldn't want it to seem like there's no engagement, because then we find if there's no engagement, then people get kind of disappointed at the end to say, it doesn't actually reflect my reality. Like, yeah,
Right.
we never talked to you. So yeah, I don't know, Mary, if you want to jump in on that one.
So just the success of this, Help Seeker can go so far, as Elena said. You need a community champion. That's someone on the ground in the community that is kind of in tune with what's happening in the community to make this successful. So when you're building your program, make sure you're thinking about funding for maintenance and time and that kind of thing after go live.
Okay. Just another question here. Can community organizations create an account and basically put their own programs and projects onto Navigi, or is it managed solely by municipalities? Or how can these grassroots organizations get onto Navigi?
So it really depends on who's running the show in your community. So for this community, the township is the kind of the quality assurance and navigation kind of in and out manager, and that was specific to them. We have other projects where it's different, where it is a bottom up. You're part of a network, a centralized intake process. So Hastings County, we should do a webinar with them to that point, but where they have members of their network of care. So it's much more like a primary care network, where it's a network. People are already pre-approved. We know that they're real organizations in this context. And Mary, you can jump in here. But in this context, the county or the township really wanted to make sure that they had a way of making sure that whoever was in here, it's their brand on it. They want to be able to vet them. So we actually manage that centrally. That's why that form is there. So then we have a collaborative arrangement where the form comes in, we scrape, they approve every single one of these, because they're then vetted by somebody. So that it depends on your use case though, right? There is ways to obviously do it the other way, but in this particular implementation, it was decided for business requirements, for business reasons, that the county wanted to have, and I keep saying the county, I'm sorry.
That's
Edwardsburg Township. Edwardsburg Cardinal wanted to have that quality assurance on making sure everything was vetted. But Mary, maybe you wanted to say something about why that was important to you guys.
I think it relates back to that initial list that was provided by Help Seeker. Again, I know my community. I know who's here. Was there data that was scraped from an old resource? Or, one thing we found that many of these organizations are ran by volunteers. and they don't necessarily always have the time. Actually, I was supposed to make that point in my presentation and I missed it, that the community has asked for losing my train of thought. Anyway, these programs are ran by volunteers and they don't always have time or think of to update my Google, update my website, so if the information online is conflicting or not complete or not up to date, how does Help Seeker know that? Right? Perhaps maybe an organization is closed and they didn't close their Google account, or they didn't get off a CRA list, or, so I'm absolutely open to expanding what we've got. And I would love to include any service that would benefit our residents. But I just need to make sure that our data is correct, because without that, if it's not valuable to the residents, they're not going to use it.
100%. Or you get a wrong link or a broken link, nothing worse. Look at, you're need a food hamper and you just got sent to a food bank that's closed because they didn't update their website. Absolutely.
So can you imagine someone being destitute, that they need a food hamper and they're trying to figure it out on this phone because their kid's hungry and the link's not working? Like,
yeah, not a good user experience.
No.
Yeah.
So another question here, and I think I can answer this one, is Navigi only available as an app, or is it also a website? And so Navigi it's a website, it's a URL that people would go to.
But to put the context on it, and the reason why is because you can save it as an app on your phone, and so it's optimized for smart smart devices as well. And most apps these days tend to just be one, because then it's actually much more efficient to maintain. You don't have to have updates going in all different directions. So you just save it on your home screen and it works as an app as well. So that's the gist. I don't know if you knew that, Mary. But you add your home screen. You add the URL to your home screen.
Yep. Yeah, we made a button. We had it embedded at first, and then people were a little bit confused about the search. So rather than searching in the Navigi window that was embedded on our website, they were going and searching on the township's website, which was a bit awkward. So we played around with changing. You can see the search bar here is white. It was blue at one point. We're just trying to make the experience best. So we decided to remove the embedding and just put a button on our website that takes you to the full Navigi site. So far, that seems to be working. That's new in the last few days. We've done that.
Cool.
Another question here that's maybe some confusion about the cost as it relates to the residents. So is there a cost to the residents to use Navigi if they're coming here searching for something?
No, this is funded through taxpayer dollars through our municipal budget. There is no cost to anybody this is an open public website. Anybody can access it.
Okay, and then another question here related to pricing. So they're saying, when I've shown this services like this to others, the response is often, we can't afford that. Is there a ballpark figure of what a service like this may cost, getting organizations mapped?
I mean, you can say how much you guys paid if you're comfortable with it, Mary.
I don't even know what we paid, because I'm not in that. Do you know, Elena? Because I don't. You're welcome to.
No, but you know what, you guys, it's I mean, yes, they of course you need to put some budget towards it.
Yeah.
I would say just get in touch with us if you're actually interested.
I don't think it was not astronomical. It was affordable for a small municipality of 7,500 residents. Now I joined this organization when the program had already been started. And in fact, my colleague was so busy with other things, this was put on the back burner for a bit. And coming in as the community engagement person, this was right up my alley. So I hit the ground running with it. And now here we are 6 months later with a launched project.
Yeah, that's really great.
Yeah.
We'll drop a meeting.
We'll drop a link if people are wanting pricing info. Yeah, just because I don't want to misspeak and sorry, I put you on the spot, Miriam.
No,
I don't know. I just to come up with the ideas.
And I'm not saying it because trying to hide it. I just truly don't know.
Yeah.
Okay, yeah, we'll drop a link for people and connect with us and we can talk through that. Another question here for Alina. Could you speak to how you ensure clients commit to keeping the tool up to date? What is the implementation plan?
How do we make sure? I mean, that's a great question. It's up to the community to value system navigation and system transparency. So if the township of Edwardsburg Cardinal didn't value this, if they didn't see value in this, they wouldn't be committed to it. So it's
So
also,
my 2 cents on that is
yeah,
that
go
it's
ahead.
a role reversal.
Yeah,
It's not for help seeker to determine, to ensure its accuracy. It's up to me. It's up to our township to ensure.
yeah,
So
yeah.
implementation plan, you know, we worked really well together, but it's also a longevity plan about, you know, we've decided we're going to do quarterly. We got the pricing for that. It's in our canned program. Actually, I think, didn't we just sign again? We just signed again, and I think it was like $7,000 or something. It's not huge, guys. It's not huge.
For 4 times a year update.
Yeah,
Yeah,
yeah.
yeah.
4 times a year for maintenance, yes.
Yeah, yeah. Especially, and the big lift in terms of time is figuring it out too. So the time commitment is like, I'm guessing your time now is not as much as it was when we
Oh,
were.
no.
Yeah.
And I would try to dedicate time, like, you know, it's a hard thing to like start and do 15 minutes here and 15 minutes there. I would take my laptop and sit somewhere quiet and like investigate, you know, the links that were there. And if it was a program I wasn't aware of, learn about it. Yeah.
And we just got 3 more questions here. Excuse me.
Okay,
So,
okay, we'll keep going.
thank you for a great presentation. Have you worked or communicated directly with service providers? I could imagine that EC Connects and Navigi in general could also be useful for service providers to help organize themselves and work together, especially when individuals require care from several providers.
Interesting. I mean, Mary, I'll take the first one just because something came to mind with that question, and then I'll pass it to you and you can chime in on it. So yes, absolutely. The Toronto Jewish implementation is specific to one organization that's servicing the Jewish community, but it's part of a bigger network. So the reason they wanted to invest in this is because they wanted to offer this as one of their services to their client community or to the community members that they were servicing. So one of their kind of big kind of value propositions is that they're helping clients navigate systems, service navigation, information and referral services. So they're funded to provide service referrals, but their staff and their clients don't have some kind of a way to do that efficiently. A really interesting example that we're currently in, and it's TBD how this is all going to come together, but we're in the middle of doing an implementation of a case management software for an Inuit organization in Ottawa, and they service all Inuit from all over Ontario and the north coming into Ottawa, and actually in Toronto as well. And one of the interesting things, and I haven't talked to them about it yet, but I will be, is they actually have 40 programs and themselves are like, where does the client go? Does it go over here? Does it go over there? So I'm like, oh man, like it could really use an internal Navigi for sure, just so that, you know, because somebody comes into one program, but they should benefit from these other programs as well. So in that instance, absolutely, I see a huge value add, even organizing their own program. And within each, what I learned again is that each department actually breaks into programs depending on funding stream. So again, the taxonomy for this organization and the Inuit lens on services, even internally, never mind externally, because they have, you know, they coordinate with probation, the court system, judges on just in the justice side. They have food, they have children, they have the entire spectrum. within one organization. So yeah, if anybody needs these things, it's for sure these organizations that manage a lot of information referrals that are very unique, for sure. And I would never dream of telling the community how to do that. They obviously know what they're doing. They just need some tools to make it smoother. So with that being said, Mary, last word before we let folks go, and I'll.
My experience is that it's been well worth, like I said, we're only 4 weeks into displaying this to our public. We're really looking forward to sharing with them at the trade show so we can talk to them one-on-one about how to use it and what their experience has been. That's going to be in a month. It's late April. I'm looking forward to talking to Nicole, who's with Help Seeker the first week of April. So I'll be writing a report to our council for April the 7th to let them know how many hits in the website we've had. So we're just going to keep chugging away and marketing this to our community and letting them know how amazing it is. We're going to keep in touch with our organizations as their programs change or information waxes and wanes. We're going to try to keep that database as up to date as we can.
Awesome, thank you. And you guys just get in touch with us if you want to bring this to your community or see a use case for your organization. Yeah, absolutely. Just get in touch. And
I'm happy to share my contact information. Do you want me to put it in the?
Yeah, that'd be great. Yeah,
sure.
and we can actually flip it to everybody when we send the package.
Sure,
today.
that's fine.
Yeah. And those of you next time, if you're interested in digging deeper into the case management connection on this, so actually tracking clients through this process and outcomes and all of those great things, that's the focus of our next webinar, and that's going to be featuring our Moretto product. So shifting gears from Navigi to Moretto on April 17th. So hope to see you there. Mary, a pleasure. Thank you so much, and looking forward.
Oh, nice to work with you.
Yeah, you too. You too.
That's another thing, is that we've spent so much time together. I feel like we're almost friends, but I've only ever seen you on camera. Anyway, your team has really been great to work with. And even through the frustrations, we all figured it out together. So thank you for that.
Absolutely. It's a pleasure. Talk to you soon, everybody.
Bye-bye.